Hello, everyone. Thank you for joining today's webinar on Better Upstream Strategic Thinking. My name is Dr. Rishi Manchanda, President at HealthBegins, and I want to thank you all for joining us today for this webinar. Before we start, we'd like you to know that this webinar will be recorded, and we will be sending this recording out to all registrants after the webinar. Please note that all participant lines are on mute, and if you have a question for us, you can enter it at any time in the question box that appears on the GoToWebinar doc. We have a reserved time at the end of the webinar to answer all your questions that come in through the question box, so really want to encourage you to use that question box throughout the presentation. The presentation is scheduled to last for 1 hour, and we're excited to kind of jump in. So let me start by reviewing some of the learning objectives that we have for today. By the end of this webinar, we're hoping that attendees will be able to describe the difference between strategic thinking and strategic planning, list some challenges facing healthcare organizations engaged in strategy development to address social determinants, list 2 lessons at least, if not more, to address those challenges, especially to facilitate effective upstream strategic thinking and planning. And lastly, we have a stepwise approach that we'd like to share with you all that we think could help make the approach to upstream strategy development more productive for healthcare leaders. As a reminder, again, the Q&A pane is yours for the taking. Please submit your questions throughout using that and tweet at us during this webinar if you are willing. You have the handles there at HealthBegins, at PSJH for Providence St. Joseph Health System, where we have a presenter from today. Also Peter Long at Peter Long BSCF for Peter Long from Blue Shield of California Foundation. So with that, let me introduce our presenters today. We're going to hear from them in a brief moment. Really pleased to be joined today by Dr. Dora Brilla from Providence St. Joseph Health System, Dr. Peter Long from Blue Shield of California Foundation, and Dr. Sonali Saluja from the USC Gehr Family Center for Health System Science. So if you don't know, but you're joining in for the first time, HealthBegins, we're an organization committed to improving care and the social determinants of health. We do a lot of work with organizations trying to improve clinical and community partnerships. Certainly feel free to reach out to us if there's more information you'd like about the work of HealthBegins. But really the core of today, the fireside chat that we want to create with our presenters and with each of you is a chance to dive into a couple of key questions. First, what is strategic thinking and how does it differ from formal strategic planning? We'll go into that in a brief moment. And then perhaps more substantively, how have different healthcare institutions like Providence St. Joe's Health System, like Blue Shield of California Foundation, our 2 presenter organizations today, how have organizations approached the task of developing their social determinant strategy? And lastly, what lessons can we learn from the way leading healthcare institutions like the ones we have presenting today, what can we learn from them about how they've developed their strategies? Again, with the kind of punchline being, at the end of this, we'll go into a little deeper detail about the 5 steps that we want to recommend for upstream strategy development. So to get us started, to try to create some interaction right off the bat, let's learn about who's on the line today. And again, I want to thank you all for joining in. Let's jump in with the first poll question to get a sense of your organization or association. Which best describes you? Are you a hospital health system, a health plan or managed care organization, a community-based organization, philanthropy, or other? We'll leave the poll open for another 10 seconds. Great, and let's go ahead and close the poll here. Thank you for voting. I think about 3/4 of you were managed to vote. Appreciate that. And it looks like we have a nice mix. About a quarter are from a hospital or health system, followed by other. Looks like actually other is the predominant category over here. So please do let us know through the chat box or through the Q&A if you have questions. Please identify which organization or type of organization you're with. That'll help us to get a better sense of how to tailor this to your needs. We have a good mix of folks from community-based organizations and health plans as well. So let's move on to the next poll question. Now that we have a better sense of your organization's background, tell us a bit more about your organization strategy. Which statement best describes your organization strategy to address social determinants of health? So we'll launch the next poll now. Oh, give us 1 second here. I think our poll is Why don't we come back to this poll? I think it's going to take a minute. We're having a problem launching this particular poll here. So think about where your answer might be for this as we get ready. And there we go. We fixed that. Thank you. So which statement best describes your organization's strategy to address social determinants of health? Go ahead and take a few seconds to answer, please. Another few seconds. Great, and let's go ahead and close the poll. So thanks for those of you who completed this poll as well. It sounds like 30% have, to your knowledge, don't have a formal social determinant strategy, whereas a good chunk, about 4 in 10, are currently engaged in strategic planning. So really welcome you to this, and hopefully this is going to be a really salient conversation for you today. A small minority have actually completed a strategic planning process. Others are 22% are implementing, and then about 10% are updating or revising their strategy as well. So that's really helpful information. And with that, let's use that context to be able to think about the challenge at hand today. The challenge at hand really is, for today's conversation, is something that we want to share with you all, and that's something that you're probably all experiencing. We know, as this poll results show, that many healthcare leaders are developing or refining strategies to address social determinants of health. We're learning a lot in the field, of course, about different models to address and finance social determinants of health. We're learning a tremendous amount about the fact that there's a whole variety of different operating models, different technical solutions, technologies even, that health systems, in particular healthcare systems, are addressing. The key question we wanted to pose to everybody today was, how are healthcare leaders and managers, each of you, shaping your social determinant strategies in the first place? Let me unpack this a little bit more and put a couple of things in context here. 2 axioms of strategy development from the field of strategic planning and management science. One axiom is that when it comes to developing strategy, real strategic change requires inventing new categories, not rearranging old ones. Another axiom that emerges from the field of strategic planning is that it's not that we lack powerful ways to approach strategy, it's that we lack a robust way to select the right ones for the right circumstances. These 2 axioms in particular we thought were salient given our experience working with a variety of health systems and their community partners when it comes to developing upstream strategies. How often are organizations like the ones you're working in right now in a process of inventing new categories rather than rearranging old ones? How often are you struggling with finding powerful ways to approach strategy and finding that it's really not a matter of a lack of tools or frameworks or strategy options, but really finding the right one for your circumstance? So with that in mind, we wanted to put the bottom line up front. This is the punchline that we're going to unpack at the end of the presentation and tell you that throughout the course of today's presentations, we're going to hear different elements of what informed this, ultimately informed this stepwise approach that we're recommending at HealthBegins, a stepwise approach to develop your organization's upstream social determinant strategy. And again, we'll go into this in more detail later, but suffice to say that what the first element is to consider which approach to take to formulate strategy in the first place. And what we recognize, again, from the field of strategic planning, from management science, from just business strategy in general, organizations tend to formulate strategy using one of 3 approaches. And they either engage in formal strategic planning, which is a linear step-by-step process that is really well-suited for predictable environments. Many organizations who are listening in right now, you may have gone through some variants of these formal strategic planning processes, gone through retreats and developed binders of data and analysis to be able to think through how to create your 5-year strategic roadmap. Others on the far right take an approach that is defined as opportunistic strategic decision making, which tends to be a more reactive approach. It's often used to effectively respond to an unexpected situation, unexpected problem, or even an opportunity. And then there's the third approach, which is strategic thinking, as the field of strategic planning defines it. What strategic thinking means, and the reason it's different from formal strategic planning and even the reactive opportunistic decision making, is that strategic thinking represents an intentionally creative entrepreneurial approach, one that that values using intuition for leaders and managers. And it has an explicit goal of questioning assumptions about the way things are currently operating, about what the future looks like. And it's meant specifically to help leaders generate new ideas about the future they want to see and how to develop a strategy to meet that future. So we wanted to set the context here because thinking about how organizations formulate strategy is a particular through line that we want for our conversation today. And you're going to hear now, as we launch this final poll, our presenters describe how they formulated their strategy. So based on what you just heard, what process best describes the way your organization first began to formulate its strategy to address social determinants, if you have? Let's go ahead and keep the poll open for another 10 seconds. Looks like about more than half of you have voted. We'll allow a few more to chime in. All right, great. Let's go ahead and close it. And a really interesting kind of mix. It looks like it's down the middle. Everybody has either, equal portions of folks have either engaged in strategic decision-making in an opportunistic, reactive way. 22% have done formal strategic planning. About 1 in 5 have done strategic thinking, and a good third are not sure. Well, if you're not sure, or if you have a good sense of what process you've used, keep that in mind as we now kind of pivot to the main event for today, which is the presentations from these leaders who we're really privileged to have join us today. I'm going to now introduce Dr. Dora Berla from Providence St. Joe's Health System. Dora, it's all you.
Well, thank you, and good morning to those of you on the West Coast, and good afternoon to those of you on the East Coast. And it's just really a privilege to be here today to talk about something that I've been very passionate about pretty much my entire career, and to be able to put the lens of strategic thinking around social determinants of health is actually really exciting. I spent the majority of my career really thinking about really being more influential in persuading health systems and really the hospitals to think more about social determinants. So to be in this environment where everyone is thinking about it and we can actually get down to strategy is exciting. So Rishi, if you want to go to the first slide, I am really fortunate to be able to lead the community health investment team throughout Providence St. Joseph Health, and we have a pretty large footprint in the West Coast, all the way from Alaska, Washington, Oregon, down to California and Texas. And so I want to start, I know we're supposed to have a fireside chat here, Rishi, so I'm going to get everybody to think a little bit about the stars, and I want to start a little bit from the beginning in terms of thinking about really the mission of Providence St. Joseph Health, because we've all heard the statement, culture eats strategy for lunch, and to really think about, do we truly have that culture? And so I just want to share a little bit about the culture of Providence St. Joseph Health and how that really tied into a very fertile environment to begin to talk about strategy. But our mission was really founded over 160 years ago. We have the Sisters of Providence settling in the Pacific Northwest and the Sisters of St. Joseph in Northern California. And they really started by addressing the social needs of community. So, thinking about, they didn't call them social determinants of health 160 years ago, but they were really addressing food insecurity, homelessness, housing insecurity, social isolation, mental health, all things that we're addressing today. So this is deep in our DNA. And then also just to today, as we talk about our strategy, really launching that we believe health is a human right. And it's not health care, but it's health, so that we're thinking about this in a much more holistic way. So it was really easy to begin to build the strategy when you've got a culture that is really supportive of it. We've had our ebbs and flows in terms of through that 160-year history of really how we're thinking about the strategy. You've had different reimbursement models, but it wasn't difficult to really begin to think about a core strategy for social determinants of health. So Rishi, if you want to go to the next slide, I want to stay in our theme of the fireside chat here. So I don't want to get too much into detail on this, but really this is an eye chart. what I want to show you here is that this is our system integrated strategic and financial plan. We have our goals and our performance over the next 5 years. I'm sure everyone's familiar with similar strategies. But what's really exciting is that we have clearly stated that we're going to engage with partners in addressing the social determinants of health with a focus on education, housing, and the environment. So to explicitly state that, I can't underscore how important that was for our system leadership to actually put that down. And then I'll talk a little bit about the strategy that's behind that. But as you think about kind of that planning and having this as an incentive metric across our entire system isn't insignificant, and we're really excited to share, what came of just that simple line on a strategic plan. So if you want to go to the next slide, Rishi, I want to talk a little bit about the components of that, because as we begin to think about kind of that moment of, wow, okay, for me personally, it was, okay, I don't have to persuade people to think about social determinants of health, but now I actually have to put a strategy to paper. And that there's some work that's involved in that, especially in traditional healthcare systems that are so designed to really look at much of the clinical model, but to think about that paradigm shift and the readiness to address social determinants really takes a holistic way of thinking about things. And I've already talked about the culture, which was really solid with Providence St. Joseph Health. Obviously, the external environment is pushing everyone that way. So we had that. But then you need to go and really think about, well, what's the structure? What are the things in terms of the organization that has been so used to looking at clinical care? How do we begin to address those essential essential health services of our local community? What's the workflow? How do you even do that? How do you begin to screen for that? How do you have people that's a part of their whole workflow? And how do we identify what those upstream interventions are? How do we even define what upstream is? And then how do you put data to this? And I'll talk a little bit about some of my experiences with data, because that's really a culture shift for many hospitals and health systems to begin to think about community health data in very different ways. And then thinking about, obviously, the competencies. I was a healthcare executive in the early 90s, and I had an MPH, and I was very rare. Most of them were MBAs. So as we think about just the new level of leadership and the requirements of staff and our team and our executives, how are we looking at managing upstream interventions? Because that's not something that we necessarily have sphere of control over. That has to be something that's done with partners, and a lot of non-traditional partners. And then beginning to think about, what's that financial readiness? And how are we, really going to be looking at this in terms of the incentives? And we've really framed it and worked really closely with Rishi, with all of our regions, to think of this as our upstream quality improvement effort, and that we're really applying a lot of the same tools and the framework that healthcare is used to. And then really having people address the value of moving upstream. And one of the things that I'm always doing is connecting the dots, because so often you have healthcare administrators that say, I am, just trying to put out the fire. How can I begin to think about what's happening in our community? And, I challenge anybody to go into their emergency departments on a Friday night and not tell me that it's deeply rooted in some of the social conditions. So 2 more slides here, Rishi. I have the next slide. Just really connecting the dots when you're thinking about the strategy. I oversee all the community health needs assessments for, our 51 ministries and facilities throughout Providence St. Joseph Health. So I've been very intentional in addressing what I call the bleed or the fires, which are the top 1%, with the core system issues and the perceived value of going upstream with our top priority needs identified in our community health needs assessment, and really taking that stepwise approach in terms of connecting the dots and looking at our data. If you look at, often the top 1% of the utilizers in healthcare from cost and utilization, you all know probably that are on the call and probably preaching to the choir that homelessness, food insecurity, mental health, substance, and access are related to about 99% of most of those. So next slide, Rishi. Thinking about, I know I'm a little short on time, but this is just our shift from going from, really far more reactive to proactive, and really beginning to think about your strategy. I love this picture because it's just really, I think about it's me moving from, persuading healthcare executives to actually having the opportunity to integrate that social model and really beginning to have consistency that's leading to transformation and not just looking at incremental change. And last slides is the last thing that I want to address and just touch base on is connecting the dots with the data. One of my moments in planning, and if you think about developing metrics, so that obviously I had to get metrics to that sentence on our strategic plan, and it was that moment when people said, "Oh, so we can reduce homelessness by 0.5% next year," because that's so indicative of how we've thought about core metrics in healthcare. So really begin to temper the expectations that is probably a long-term community-based metric, but there certainly are health system metrics that can connect the dots, looking at avoidable ED visits and long lengths of stay, and really identifying the strategies that are going to get us there. So those are really key lessons, key considerations and lessons that we've learned throughout the process. But it's really been a privilege to work with Rishi and to be on this journey with all of you, because I know none of us have it perfect. So with that, Rishi, I'm going to turn it back to you and turn it over to Peter.
Dora, thank you so much. And in the Q&A section, I will be coming back. There's been a lot of good questions coming in from attendees so far. I've got a few questions as well where I want to dig into more of your personal journey as well as your colleagues in developing that strategy. And I really appreciate you taking the chance to kind of walk us through that. And without further ado, here to give us another perspective from Blue Shield of California Foundation, Peter Long. Peter, I'll turn it over to you.
Great. Thanks very much, Rishi. It's such a pleasure to be here today, and welcome to everyone. So I'd like to, any good fire, as people know, needs a river next to it in case things go out of control. So you have a fire and a river image. But so I want to share with you some thoughts and reflections upon our journey to a new strategic plan. As you can see from this slide, it really has been a journey. In 2016, Blue Shield of California Foundation took the first steps on a journey that would have radical implications for our work, our impact, and frankly, our whole organization. So over the prior 6 years, we'd achieved considerable success in our work to expand access to high quality care and to end domestic violence in California. Through financial support, we shaped the creation of healthcare services for low-income patients and domestic violence services that readily took into account the experiences of survivors and patients. We demonstrated in multiple cases how you could better integrate disparate healthcare services, such as primary care and specialty care in the Medicaid program, behavioral health and primary care, and how you could actually look and integrate even a social service like domestic violence and primary care. We'd actually created a network of established leaders in the field and felt very good about our work in building out the healthcare safety net and the domestic violence field here in California. And as that plan was wrapping up, our last strategic plan, we began to ask ourselves, are there new ways that we could promote health and well-being of all Californians, who in many cases had been receiving services and so had benefited incrementally from some of our previous investments, but was there something more fundamental we could do to actually improve their health and well-being? So ultimately, and this actually started in 2016, we made the big decision to decide the most impactful path for our work was to fundamentally change our approach, like Rishi said, to change our strategy and change our tools to address the upstream causes of poor health and violence. So you can see on this slide here, in early 2016, we determined that we would move upstream. And then interestingly, we fell back in, I think, a very traditional, same slide please, we fell back in a pretty traditional approach of how do you identify strategic tensions. We defined our values. We built from our strengths. But it wasn't until, and I want to just call your attention to exploring upstream pathways and potential outcomes and share a story. So I think what we had started to do was use the very similar reductionist strategic planning view to address root causes of poor health and violence. And frankly, we were pretty stuck, and we kept coming back to, and what it's interesting, each time we'd have a planning session, we'd say, well, that feels a lot like our current plan, or that seems like an incremental improvement on what we've just been doing. So we would go from behavioral health to add substance abuse or treating substance use. And we'd say, well, that doesn't feel that satisfying, and are we really getting at the root causes? And I was in the boardroom one day, someone actually on a whiteboard drew a picture of a river or a stream and said, what we're really trying to do, this is our image. And then above the stream, they actually drew a North Star and said, okay, this is what we got going for us. We know we want to go upstream, and we know we need a North Star. And it was interesting, that incredibly simple metaphor unlocked us from our previous ways of thinking and our previous mindset. And it was interesting how the idea started flowing, and people went on the board and started saying, well, what if we actually did this? And radical ideas around community engagement or thinking just fundamentally differently about how you would approach some of these topics. And it was interesting, we actually left that diagram on our boardroom for probably 3 or 4 months, and people would come back and say, wow, that wasn't quite right. Let's go back and rethink this. Or does this come before or after this in the sequence of how we are to produce health or end domestic violence? And so it was interesting when we allowed our minds to be open to the possibility of a future rather than applying our tools to drive a different future, is really when our plan took shape. Next slide, please. So what we did actually hold the structural tension. We believe that's actually a really important piece of our strategic thinking. And you can see here, this is our bold goal that we've set from ourselves that says we want to make California the healthiest state in the country and the state with the lowest rates of domestic violence. Clearly, a foundation based in California, a health foundation, an amazing health foundation based in California, cannot do that by itself. So automatically baked into our bold goal was the idea that we needed bold thinking, we needed to lean into possibility, and we needed partners. So this is not a plan that the foundation could control or that we could dictate or drive. So by baking into our bold goal something that was well beyond our reach and frankly even beyond our imagination, we set the bar that we had to actually think and act differently. The second thing we did very importantly about our bold goal, because we can set a lot of aspirational things and it becomes, just an aspirational vision with no practical meaning. So we also set some definition around how. And this is very consistent with our grounding as a foundation, that it has to be driven by people's needs and people's aspirations. So the second part of our goal is to leverage the power of community and collaboration to generate change. So again, this is not just change for change's sake or doing things to and for people. This is actually co-designing a future with them. And we set that as our true north to help us move forward. And I think that really guided each of our steps in the process afterwards. Next slide. So the results of that, and I'm fast forwarding here, of 18 months of incredibly hard work and lots of meetings and lots of consultations, but just to give you a sense of where we ended up with our strategic framework and our strategic plan going forward. And the first thing to note on this slide is the explore, invest, learn, and engage, which is very different than we're going to develop an initiative for $10 million with 7 health centers, and it's going to take 3 years, and we're going to, as Dora was saying, move the needle on homelessness by 0.23%. Instead, we actually adopted not just an emergent approach to strategy, but an emergent approach to our work. First, explore the issue and get to know it and understand the deep root causes and the systemic effects. Then make some preliminary investments in some experiments, and experiment and think about what we learned from those, take those learnings, and then engage with our partners and continue to explore. So this actually, in some sense, should look like a cycle, but it's a fundamentally different way of doing business for us. So by setting that bold goal and developing our upstream or taking on an upstream approach, it's actually caused us to do all of our investments very, very differently. And then we have 3 areas that we felt like that are all interconnected. In the past, we'd had discrete initiatives. We would choose a body of work and we'd work on it for a set period of time. In this case, we said we want to do three things that are very interrelated, very similar to what Dora was speaking about, the intersection between homelessness and violence and food insecurity. In this case, for our foundation, we started with breaking the cycle of domestic violence, and I'll come back in a minute and share an example of how that plays out in practice. But instead, if we really want to end domestic violence, we need to think about more than providing services for those who've experienced it, to actually new sets of strategies to break the cycle before violence begins. And then second, just to lean into our approach around collaborating for healthy communities. And in this case, we actually took a fundamentally different view of collaboration. Often foundations build their own prototypes, give it a trademark, and say, this is voila, our project that we want to show off to you. Our understanding is that all of this work will happen through collaborations, but what we need is a deeper understanding of how communities and how organizations, institutions collaborate. What are the key design elements that are true across any form of collaboration? What are the elements such as data or the payment methodology or distributed leadership? And getting very intentional about what those features are, and then sharing them out with others in a kind of democratized way so that they could take their work forward. And then the final, I think, in some ways the most interesting and outside of the box is something we call designing the future of health. And here's our realization that if we continue to work from the system we have today and try to push it incrementally forward, we'll never get to a place that is truly improving population health. So this is saying, if we unconstrain ourselves in the present and say, what's the future that we want to create, whether it's the future workforce or the future of the health promoting systems in communities, or the systems that support families to actually, control their health and improve their health and well-being, what does that look like? And so that's been actually a great exploratory piece of our work about thinking about and imagining a different future. And we realize that none of this happens without a strong policy and communication and building out the infrastructure to actually enable all of these work to happen. Next slide, Rishi. So I just want to share in closing two examples, because I think we often talk about how these things, the frameworks, but I want to share just two examples of how this has played out in our work. And the first is under that I just described, the designing the future of health. And I want to call your attention to the right side around sustainable funding. And one of the places we've realized that we get stuck, and almost all of our colleagues get stuck inside the healthcare system, whether you're in a plan or you're in a healthcare provider or even at a health foundation, is that we don't have a good mechanism to value preventive efforts or efforts that promote health or prevent something bad from ever happening. The current system, most of our thinking is defaulting to, does it save money for the current healthcare system as it's currently established? What we said is, if we don't actually fundamentally address that issue of how do we think about valuing preventive services, preventive programs, preventive culture shifts, we're actually going to keep getting stuck, and we're going to keep driving, whether it's a round peg or a diamond peg, we're going to keep driving it through that square hole. And so we put out a request for proposals last spring, and I think we had 143 applicants. And the question was a very simple question, which is, how could we value prevention differently to produce different outcomes? And we got an amazing diversity of respondents, some who are tackling the methodology of things like return on investment and how we calculate, some folks who are looking at the wrong pocket problem where education makes an investment and healthcare reaps the savings, or juvenile justice makes an investment and education receives the savings. And so we now have a cohort of 16 grantees where we are doing a deep exploration of how can we value prevention differently to produce different outcomes and fund different services as a foundation, but also as a health system. Next slide. And then another example, and this is in breaking the cycle of domestic violence, another example of how we're working differently under this new strategic plan and how it shows up in how we as a foundation choose to make our investments. This is a life course framework. It's a very simplified version of a life course framework. And the key concept here, and it should seem self-evident, but I think making it real and manifest for folks actually really does change how you approach the issue. But violence doesn't start when someone is 25 or 30 years old experiencing violence in their intimate relationships. It actually starts with early childhood exposure. It is also influenced by your adolescence and your peer groups. Clearly, as a young adult and you're forming your first intimate relationships, all have a strong correlation with whether you will either be a perpetrator or survivor of domestic violence as an adult. And so if you follow that logic as a foundation, you have to shift your investments from funding services largely for adults who've already experienced violence, probably not one time, but multiple times, to shifting it to preventing violence in families as it's occurring, and to then actually dealing with early childhood exposures and trauma and the adverse childhood experiences. And so for us, this has been a revolutionary way to help us rethink our investments and shift them up, not just upstream in the system, but upstream in the life course to actually prevent violence. And if our goal is to end domestic violence in California, we believe it's essential to take these actions based on that, reframing our work for upstream. So those are just some examples. I have many, many more to share with you, but they're examples of how we moved from a service-oriented, system-funded foundation to an upstream foundation that is fundamentally working differently to try to prevent violence from happening and promoting health in our communities. Thanks very much.
Peter, thank you so much for that. And I think as we introduce our next speaker, Dr. Sonali Saluja, we want to note that there's a lot of great questions coming in through the Q&A. And so for those of you who can hang on, we're going to get to those in a few moments after we hear from Dr. Saluja. Some really great questions coming in right now, both for our presenters as well as in general. So with that, Dr. Sonali Saluja, welcome, and the mic is yours.
Great, thank you, Rishi, and thanks to all of you for joining. So thank you for the opportunity to share the research that we have done on the topic of social determinants of health and how organizations are developing strategies to address social determinants of health. So that's what I'm going to be talking about. So as we've been discussing, we're increasingly observing healthcare organizations trying to address social determinants of health, but we don't really, at least in the literature and broadly, kind of understand how organizations are formulating or developing these strategies. So for this research project that we undertook, we were interested in asking the question about how different healthcare organizations are formulating their strategies to address social determinants of health, and then more specifically, if they are using frameworks to help them shape their strategies, and if they are, how are they using those frameworks? And so our research team included people with a diverse background. So the team was led by Rishi Manchanda from HealthBegins. We also had Diana Rios from HealthBegins. And then the team included myself and Michael Hockman from the Gehr Center for Health System Science at USC, Sneha Panganamamula from the Keck School of Medicine, and then Lauren Taylor from Harvard Business School. So we can go to the next slide. So for our approach to answering this question, we first, as all good researchers do, started with a literature review. And we really wanted to make sure we knew what were all the frameworks that were out there that purported to address social determinants of health to get a better understanding of the lay of the land. And what we ended up finding was that there are a lot of these sorts of frameworks out there, but most of them were actually operational frameworks as opposed to strategic frameworks. So strategic frameworks help organizations develop plans for their long-term goals, as Rishi has discussed. But what we were seeing was a lot of these operational frameworks that, such as mechanisms for screening for social determinants of health, or things like frameworks to help with community organizing. And so there weren't as many strategic frameworks addressing social determinants of health as when we actually took a deeper dive and looked at what was out there. And then the next step was that we selected 4 different healthcare organizations in California that we knew had recently engaged in the strategic planning process around social determinants of health. And all 4 organizations were nonprofits, but were otherwise quite diverse. So the 4 organizations included Blue Shield of California Foundation, Providence St. Joseph's Health, Hospital Association of Southern California, and then the last was the Inland Empire Health Plan. So as you can see, all very different organizations, but they are all in the healthcare space. They're all nonprofits, and really they all are caring for vulnerable populations on some level. And so our research team interviewed 3 to 4 different leaders from each of these organizations to ask them about their strategic planning process, about their organizational priorities and goals around social determinants of health, and then how their organizations really formulated their strategies to achieve these goals. And then we transcribed our interviews, we coded them using a mixed inductive and deductive approach, and we used Deduce software to analyze our code, which ultimately allowed us to generate themes around our research questions. And so you'll actually be able to see our final results from this study in a forthcoming paper that is going to be published soon on the Blue Shield of California website. Next slide. So again, just a little bit of background about frameworks. So to make sure we're kind of all on the same page with definitions, so we define strategic frameworks as conceptual frameworks or models that help leaders choose or develop a strategy for their organization. So something that gets organizations to plan or to tackle those long-term goals. And in contrast, operational models are what are used to then really execute those chosen strategies. So here we have some examples of common strategic frameworks that were cited during our interviews. And so first I'll start with, in the upper left is the Upstream strategy compass. So this framework uses a 3x3 model with different levels of prevention and levels of intervention to approach population health. And then on the upper right is another framework called Pathways to Population Health. And the central theme with this model is health equity through, again, population management and then community well-being. Then on the lower left is the framework called the Health Impact Pyramid. And this model focuses on levels of population impact. And then on the lower right is the Health 3.0 transformation model, which focuses on community integrated health systems. And so you can see that while all these models look very different, they are all focused on population health, and they're conceptual models, so none of them are really very prescriptive. You can move to the next slide, thanks. Okay, so what we found, so this is just a summary of some of our findings, and we of course encourage you to check out the paper for our full findings. So one of the things we asked our leaders about was really what was driving them to develop a social determinants of health strategy. And we found that these drivers that people discussed fell into 2 broad categories. There were internal drivers and external drivers. But the people we interviewed were much more likely to cite internal drivers as the forces that help to encourage them and to develop their strategies around social determinants of health. So things such as mission and values, like what Dr. Barilla mentioned with the mission at Providence St. Joseph's and the DNA of the organization, those sort of things help to drive their SDH strategies. Also things like data and needs assessments that some of the organizations actually undertook to better understand the social determinants of health needs of the populations that they were serving. And then other internal driver was things like leadership and culture. External drivers such as financial incentives and policy were important, particularly for some organizations, but they played less of a role really in driving their strategies. And then we interviewed people, well, the people we interviewed had a lot of good things to say about frameworks, but I'm going to focus a bit more on some of the challenges that they cited. So one of the challenges that we saw was that there was a lack of agreement around how to define social determinants of health. not just from one organization to another, but also from one person within an organization to another. So some people saw social determinants of health really primarily in reference to healthcare and healthcare needs, while others saw it more in reference to community needs and other types of non-healthcare related needs. And then, beyond that, others really viewed social determinants of health through the lens of health equity. So there was just a lot of variation in terms of how people viewed social determinants of health. And then the other thing that we saw was that when we drilled down and asked people how they selected their strategic framework, people expressed a lot of confusion over which framework was best for them. And in fact, one person used the term framework overload, which we liked. So this person said, it's like there's always framework overload. Anytime somebody hears a new framework, you come back and apply it, and the last one is gone. So we can move to the next slide. So I think there were a few big take-home messages from our research. So one was that healthcare leaders are interested in transformational change, and they recognize the need for creative strategic thinking. So as Dr. Long had described earlier with the North Star metaphor and the bold goals for California, they're really interested in these kind of big paradigm shifts that can move them forward. And then the next was that there is a demand for the right strategic framework around social determinants of health. And I think people are looking for one that advances population health, but also links that population health goal to the organization's unique environment. And then lastly, because we're heard from folks that the framework market is crowded, it is very challenging to find the right one. And I think we need to do more work on I think that we can do that by one, establishing a common definition for social determinants of health, and then also by creating a guide or tools that can help organizations find the right framework that fits their unique environment. And so with that, I'll hand it over to Rishi, who's going to talk more about how we translated some of these lessons learned into more specific recommendations.
Sonali, thank you so much, and thank you to Dora, to Peter, and Sonali, of course, you as well, for your presentations, and thank you for all so far. A lot of good questions coming in. I'm going to take this moment just to put a capstone on these presentations and turn it before turning it over into a Q&A, and we'll get to some of the questions that you've already raised online and keep them coming. The summary kind of that Sonali kind of referred to was this notion that there is a way that can help organizations, be smaller healthcare organizations, medium or large health organizations of different sorts, from payers, foundations, health systems, to think through how to develop a social determinant strategy. One of the things that we heard consistently, as Sonali was referencing, and we heard a good amount of, as Peter, as you were talking, and Dora from your presentation as well, is how important it was to start with generating ideas. And we wanted to underscore this first part in particular because several of you online have already kind of posed some really important, challenging questions. For example, David Aylward mentioned, are we not just playing at the margins? Are we looking just at incremental improvements until we really change what we're paying for? So getting to the root of the payment system itself, and what does all the strategizing mean if we don't change the underlying incentives? To other questions that have come in online about the fact that on the ground, for a lot of smaller organizations, especially the ones connected to the front lines of service, there is no choice but to develop creative approaches to strategy, because resources are limited and the need is acute. And these are questions, for instance, from Kenneth Peach online as well. A lot of really great insights that have come in about this first element. And what we wanted to reflect on is that drawing on the experience that we're seeing in the field, and also drawing on the best practices from strategic planning from other fields. As healthcare and other industries have gone through efforts to develop strategies to a shifting environment, want to underscore how important it is to start with a process that doesn't necessarily take a reductionist, overly formal approach to strategic planning first, but really starts intentionally with a strategic thinking process, a creative process, dedicating space to be able to generate those ideas. And so that's step one, generate ideas using strategic thinking, which is a creative approach. And again, more details are in the white paper that Sonali referenced and that we'll send to everybody tomorrow, actually, as a wide blast, not only everybody listening today, but to everybody on the HealthBegins listserv and the Blue Shield of California Foundation, as well, is going to blast that out soon as well. But one thing in particular I want to call out about what it means when you're generating ideas, and as well as going through each of these steps that we're recommending here, as you can see, is that it's important to do a few things while going through the process. One is engage community partners at every step, especially in the beginning. What we heard consistently from leaders was how important it was to have the voices of those you're serving, especially the voices of those you're partnering or want to partner with in the community, the non-healthcare sector, to be engaged in the process. Authentic engagement. And the earlier we believe that you can start to engage folks, especially in generating ideas, the better, to be able to challenge assumptions, to be able to push the boundaries, including push provocative notions of what about the underlying kind of payment structure, or the things that we can do in a big, bold way rather than incremental ways. The second thing was that there has to be an explicit focus throughout on equity, on having a preferential option for the poor, for vulnerable populations. And this is where Dora's presentation and the roots in Providence St. Joe's history with Mission, I think, are particularly salient. How do we make sure that there is a consistent thread throughout about thinking about disparities and beyond disparities about equity, not just in terms of racial, ethnic populations and the disproportionate share of disease experienced by minority populations, but also questions of structural inequity, the imbalance between healthcare and the social sector and public health, for instance, when it comes to resources and institutional power. These are important considerations that have to be part of the conversations in step one and throughout. Anyway, after generating ideas, we recommend a process to sort those ideas where an initial draft portfolio can come together, a portfolio of different strategies to address social needs and social determinants, followed by an opportunity to take that draft and then in step three, assess that draft against the backdrop of your environment, what's happening in your business environment, in your policy environment, locally and regionally. And then based on that, especially with engagement and input from community partners, then write the plan itself, refine it, develop and refine the strategic plan to address social determinants. And then finally, and only at this stage, to translate this in step 5 into a roadmap. This is where operating models, structures, and programs and relevant KPIs become relevant. This is a process we know is iterative overall. We're presenting it in a somewhat linear fashion, but we want to emphasize how important it is to draw on the experience we've had to go through a stepwise approach, and that it comes from experience as well as a review of best practices in the literature. The last point I'll make as we turn back over to Q&A now is that what we found, as Dr. Saluja just mentioned, is that different frameworks that are out there, from the strategy compass to pathways to population health, to the health impact pyramid, to the health 3.0 transformation model, et cetera, that a lot of these frameworks are best suited for specific steps in this process. No one framework is right for each step in this process, but we believe that with the 70 plus population health frameworks that are out there that are leading to framework overload for a lot of health systems, the right next step to do is to be able to start to sort and identify which frameworks are appropriate for which stage in the strategic planning process. Again, we talk about this more in the white paper, and without further ado, let me pivot to Q&A in the last segment here. And turn this question to you from the audience, and I'll take this, Dora, to you. A question that came in from one of the audience listening in was about data and the importance of cross-sector kind of data. You mentioned this before about how important it was to have data to inform strategy. Can you put us in the room about when Providence St. Joe's, when the community health investment team was developing strategy, how important was it, and when was it important to start thinking about the different data sets required to be able to push your strategy to the next level?
Yeah, well, thank you for that question, and that's still a journey, as anybody knows, working in cross-sector data, that we're evolving here. But as we thought about our community health needs assessment, and that's why I showed the framework for our data, that we're looking at leading and lagging indicators so that we can connect the dots. And, really looking at what the publicly available data, we worked quite a bit with Esri and Community Commons, the National Center for Vital Health Statistics to really look at what are all the other sectors evaluating and looking at. And each one of our regions have had community collaborations. And so data was right in the middle of the room. Because everybody wants to turn the dial, to Peter's point, everybody wants to move the needle, but we have to be careful with what needle we want to move because, these big societal bold goals take 10, 20 years. And so we have worked, and that's really a part of, a core part of our strategy this year is looking at that data capture plan from our own electronic medical records to that community data. And I think I saw somewhere, who's paying for that? And I think, we have multiple examples. We don't have a solution across the system yet. Mm-hmm. But, for example, in Alaska, we have a whole coalition that's really looking at a coordinated entry system for data. So really thinking about how do we pull in that, that bold goal in a community, galvanize around it, and begin to collect the data on it.
Dora, thanks for that.
Do you want to add anything there? I was going to say, do you want to add anything there because you've been so involved?
Yeah, no, I think you put it well, and I think I'm going to take the baton and actually turn it over to Peter to get to a kind of an adjacent point here. Data clearly plays a key role, and data from and data engaging with other sectors that have not been part of the traditional healthcare data set, I think seems absolutely crucial. I wanted to turn over to Peter to ask you to tease out something that I think is an academic point or something that might get lost as just something that's academic and not really critically important, and that is the important point of the strategic thinking process. Clearly, there was intentionality that your foundation took when creating space for people to challenge assumptions that you described the river on the board. Can you speak to, do you believe the strategic thinking process is essential? What does that mean? What does strategic thinking mean relative to the other kind of traditional approaches that healthcare systems might take or healthcare organizations might take?
Sure. I think it's a great question. To us, it's not academic at all. I think when we started, I'm an academic, I'm a health services researcher by training, and you think, oh, okay, it's a framework, strategic planning, strategic thinking are all the same. But I think in two ways I would highlight how it really has played itself out in our organization as different. And the first is, under a strategic framework, your answers are really important, like what answer you're trying to achieve or what the answers are very important. In strategic thinking, it's are we asking the right set of questions to generate the information such that something happens. To me, I tend to correlate strategic planning with more linear and strategic thinking in complex environments where you can't move one particular, change one input or change one thing in the equation, and then the outcome is different. In a complex environment, you have to, kind of look at create different experiments, learn from those experiments, reinvest. And to me, that's a fundamental mindset shift that then leads to a different set of actions. So you tend to do many more small experiments and set hypotheses of questions you're trying to answer rather than we will improve behavioral health, the integration of behavioral health and primary care, and we're going to do it in this time frame in this way. And so that mindset shift has actually been pretty fundamentally changed the way we've worked together. And then the second thing I would say for us is it's opened up what is data. In a strategic planning framework, data tends to be largely quantitative sources, and I think in a strategic thinking framework, data can come from qualitative sources or from hunches, or just there are a number of different data inputs that you open, and insights that you open yourself up to, and they all have value rather than saying that there's a particular, there is an equation. In our last strategic plan, we had an equation of how we thought it work together. And this new strategic thinking could be nothing further than truth. We have a set of questions we want to answer. And so to me, that's how it we approach it and then how it plays out in practice.
Peter, thanks for that. And I know in the last few minutes, I want to elevate a particular question that came from Kenneth Peach, who was listening in, may still be on the line. Kenneth mentioned that he's with a tiny not-for-profit in Orlando with 3 FTEs using a medical assistant and community paramedics, and they're extending referring physicians' care plans to patients with chronic health conditions into the home. He said, and I'm going to read this quote to everybody, including our presenters, "Creative strategy was a must as we found unhealthy living conditions from day one, forcing us to identify and establish links to community agencies quickly." One of the things that I wanted to highlight, I think what is really salient and resonates with me from Kenneth's statement here and comment is when it comes to strategic thinking, to this kind of creative process, a lot of traditional larger healthcare institutions, whether it's a system, a foundation, a plan, a payer, whatever, the larger the organization, the more bureaucracy is involved, the more there is a risk for formal strategic planning, that linear process, to be the process that's used to develop creative approaches to strategic thinking. And that's, I think, problematic. It's particularly problematic because it doesn't actually honor the experiences from folks like Kenneth and others on the front lines out there who have been, by necessity, coming up with creative solutions, creating creative strategies to be able to address social needs for individuals and think about social determinants for communities from day one. And so what I think is really a connection I wanted to call out for everybody as we close here is that strategic step one is probably the most important step in this 5-step process we wanted to focus in on today. We invite you to look at the upcoming white paper that will be released tomorrow to look at each of these steps in a bit more detail. But when we think about the experiences of those who have long been working on the front lines to connect healthcare and social services, creative strategic thinking was baked into the DNA of how they solved this. And what's remarkable now is to see large organizations like Providence St. Joe's, like Blue Shield of California Foundation, and many others around the country starting to follow suit, think about how to now engage in creative thinking at their level, at their scale, to be able to do the same thing and achieve more upstream impact. We are at the top of the hour. For those whose questions we couldn't answer right now, we will follow up with you offline. For those who've stayed and hung on with us, thank you so much for tuning in. Look for the white paper coming out. We invite you to complete the follow-up survey that's going to come in your inbox momentarily. Please share with us in an ongoing way your insights and ideas, and stay engaged to learn how to continuously improve engagement of folks in your healthcare system and clinics and staff and across your organization. We thank you for joining us. We want to express our thanks again to our presenters, to Dora, to Peter, to Sonali, and look forward to seeing you on the next webinar and future engagements. Thank you all. Have a wonderful day.